Hi everyone, welcome once again. In today's video, I'll be talking about another station in Oski, which is the pressure area assessment station. This is a silent station and it is 8 minutes. We have a video on this already, but I'll just be taking us through another scenario. Like I said, it is 8 minutes, so you really need to work on your time, and it's in 3 parts. So you have the first question, which will be asking you about areas that are vulnerable to pressure risk. So in that part, you are expected to write minimum of areas, okay? And then the second one will be, what are those signs that will indicate that there is a pressure ulcer development already? And for this as well, it is expected that you write 7 minimum. Okay, so I wouldn't be going into details with that. You can have a look on the previous video on pressure area assessment. We have an acronym for those 2 parts, and then you can read those ones through. All right, so I have a scenario here. I'm going to be reading the scenario, and then I'll be also solving the scenario as well. So in this station, you're going to have your question paper, you have your pen, and then you have the what we call the Braden pressure ulcer risk assessment tool. All right, so I'm going to be reading the scenario now. Mrs. Jones is a 70-year-old female who responds appropriately to questions and is able to verbalize when she has pain and in discomfort, and currently not able to wait to bear, and must be assisted into her chair. She is incontinent of urine and uses pad and occasionally diaphoretic. She makes occasional slight changes in her position but needs help to reposition herself. Alright, she eats about half of her meals and needs encouragement to eat. She requires a great deal of assistance for repositioning in bed. She frequently slides down. So for this skill station, you have to just note those striking words, okay, because there are some things that is expected of you. Like I said, there's a tool that you're going to use. So we're going to be going through each of those parameters one after the other. So the first one is sensory perception. So you have 4 points in the sensory perception. You have 4 scores, rather. You can either score the patient 1, 2, 3, or 4. All right, so if you look at this this scenario, it says that Mrs. Jones responds appropriately to questions and is able to verbalize when she has pain and in discomfort. So for this, the most appropriate score for her will be a score of 4, which is no impairment, responds to verbal commands, has no sensory deficit, which would limit ability to feel or voice pain or discomfort. So for sensory perception, I'll be giving her a score of 4. Tick. And then the other parameter I'll be looking at is moisture. So let's see from our scenario, what can we bring out about as regards moisture. So it says she's incontinent of urine and uses pad. She's occasionally diaphoretic. So note that word, she's occasionally, okay, meaning not often. All right, so looking at the scores that we have, the most appropriate one for her will be a score of 3, which says skin is occasionally moist, requiring an extra linen changes approximately once a day. So we give her a score of 3 for moisture. And for activity, so we are going back to our scenario, and for activity, it says that she is currently not able to weight bear and must be assisted into her chair. So which score are we going to give her? The most appropriate score for this will be a score of 2, which says ability to walk severely limited or non-existent, cannot bear own weight, and all must be assisted into chair or wheelchair. That is the most appropriate. So while looking at this, you have to look at that particular score that fits in for that scenario. The next one is mobility. So for mobility, it says she's okay. Yeah, for mobility, it says she makes occasional slight changes in her position but needs help to reposition herself. So she can make slight changes occasionally, but she will need help for repositioning. So looking at mobility, the most appropriate will be a score of 2, and the score of 2 says makes occasional slight changes in body or extremity position but unable to make frequent or significant changes independently. And that's exactly what our scenario says. So the next one is nutrition. And from our scenario, it says she eats about half of her meals and needs encouragement to eat. So she eats about half of her meal. We are going to look at the score that fits in for that. And for nutrition, if you look at 2, it says rarely eat a complete meal and generally eat only about half of any food offered. So that is the most appropriate option for Mrs. Jones as regards nutrition. And the last one is friction and share. So for friction and share, we're going to look at our scenario, go back to our scenario again. And for that, it says she requires a great deal of assistance for repositioning in bed. She frequently slides down. So a great deal of assistance means she requires a lot of assistance. She requires maximum assistance. So from with friction and share, the best score for her will be a score of 1, which says requires moderate to maximum assistance in moving. Complete lifting without sliding against sheet is impossible. Frequently slides down in bed or chair, and that's fitting appropriately for Mrs. Jones. So with this, it gives us a total score of 14, meaning that Mrs. Joe has a Braden Pressure Ulcer Risk score of 14. And that is the end of this scenario. Thank you so much for watching. Just keep practicing, and if you have any scenario, you can just practice it and send it and just send your score on the comment section. Thank you so much. Bye for now.